It's a terrifying thought, but this summer, which is upon us, someone will die every minute from drowning. You know, we've seen videos like this one where a woman became submerged underwater, and her 5-year-old, in this case, actually came to her rescue. This is extraordinary. It pulled her from the pool, saved her life. But if it happened to you or your loved one, would you know what to do? It can be a life or death decision. Here to continue our 5 Minutes to Live series is Fox News Medical Aid Team, Dr. Marc Siegel. He's live from South Nassau Community's Hospital. All right, Dr. Siegel, save a life.
Brian, we're here on Long Island on the South Shore at South Nassau Community's Hospital in the emergency room. Water all around us. Bay, ocean, pools. Outside this wall is water. A lot of kids are going to be getting into trouble this summer, and we want to help you with that. We're joined today by Dr. Joshua Kugler, who is the head of the emergency room here at South Nassau, and he also is formerly a physician for special op, and he's very well trained in this. Welcome to the show. Dr. Kugler, how do you know if a kid's in trouble at your pool?
Well, first, thanks for having me, Dr. Siegel. It's great to be here, and as you said, we are surrounded by water, and the summertime is upon us. So the most important thing is prevention. Swimming and safety is the most important thing. How do you know someone's in trouble? You look at their eyes. A child who's in trouble at the pool is going to look to get out of the pool, but they cannot get out of the pool, or they may be going under the water. You look at their eyes, they'll raise their hand, and that's the time to intervene.
If you think somebody is drowning, you want to take them to the emergency room. What do you do to stabilize them, and what do you do in the ambulance? Very
good question. So it's a very different approach when you're outside the emergency room. At a beach or at a poolside, the most important thing is to make sure the scene is safe. So anybody who's going to be a potential rescuer has to be safe. They don't want to be a second victim. So if it's a rough water situation, make sure you're prepared to go into that water to bring that patient out, bring them to the beach side, identify the fact that they're having a difficult time breathing, and open their airway. The most important thing is to simply open the patient's airway by lifting the jaw upwards, and that should help them spontaneously breathe.
Now, you're in the ambulance. What do you do in the ambulance? If they're dying, if they look like they're going to stop breathing, what do you do?
So we have other tools in the ambulance to help patients. Here in Nassau County, we have a bilateral...
Show me how this works.
It's a BiPAP machine, and it really works by pushing air into the patient with positive pressure. Again, opening the airway up and preventing the person from suffocating from the fluid on their lungs. This will displace that fluid around the air sac and allow them to oxygenate.
Now we're in the emergency room, and I know that more than half of people that come to the ER with drowning, either they don't make it or they have serious complications. So what are you going to do in the emergency room to stabilize someone, give them their best chance?
Again, another great question. We have a continuum of care. Airway emergencies and submersion injuries are along a continuum. We will continue to use the CPAP and maybe change it into BiPAP, which is bilateral or bilevel positive airway pressure. And then if need be, if the person's respiratory rate starts to go down and they have a difficult time breathing, we can put a definitive airway in for them and breathe for the patient to get them through the scenario.
Show me how that works.
So we have right here we have a fiber optic intubation assisted tool, and basically we would take this and we would place it into the patient's airway looking at the camera, and you can see right there that is the patient's airway, and we would place the tube right into the airway at that point and breathe for them.
You also have crash carts around here if a patient develops an arrhythmia, if their heart stops beating. You have it color-coded for kids. And you really can see that if someone has a problem from a heart point of view, you really can intervene right away and save a life. Brian, back to you. You have a question for us?
Yeah, I do. Real quick, I guess if you have one of these parties, you got to get a lifeguard, especially with kids around. Number two, I'm just wondering, guys, do you have an idea of how much time you have before someone's underwater and getting them out of the water before they'll be suffering brain damage or will pass away?
Great questions. You need a lifeguard at a pool, he's pointing out. And how much time do you have, Brian wants to know, when someone's submerged to get them to help?
Right. So submersion injuries come of two forms. There's a dry and a wet drowning. Sometimes water doesn't enter the lungs, but both of them end up resulting in the same thing, which is the body can then have a reflex where it will build up fluid in the lungs, and the patient will have a difficult time breathing. The thing I can tell you is the most important thing is to make sure you go to a hospital or an emergency room to be seen. These are not things that you want to sit on at home.
Thanks very much, Dr. Kugler. We're going to answer further questions on our Facebook page. Brian, back to you.
All right, thank you very much. And now that I have a pool, I got to keep that in mind, too. You never know. All right, thanks, guys. Great stuff.